Assalamu alaikum everyone. Could you please step forward, inshallah, take a seat. A'udhu billahi minash shaitani rajim. Bismillahir Rahmanir Rahim. Allahumma salli ala Sayyidina Muhammad wa ala Ali Muhammad. So dear brothers in Islam, Assalamu alaikum again. Inshallah we'll get the program started now. So on behalf of our Birmingham Islamic Society, it's my pleasure to introduce Dr. Ehtesham. Inshallah, he'll be introduced very quickly. Before that, I'm going to hand it over to Sister Samina to talk about the program.
Assalamu alaikum. I'm Samina. I'm going to actually introduce you today our speaker, Dr. Ehtesham Haq. He is a clinical professor in the UB School of Medicine, and also he's a president of the UPNA Alabama chapter. Dr. Haq, we want you to, in front of the audience, actually, I'm meeting you for the first time myself too. Assalamu alaikum. And thank you for having time with us today. So I'm going to hand over the phone. And this is a very, very, very good topics because even our prophet actually faced this kind of challenges in his lifetime. He has only his daughter and Fatima Rasulullah, actually he lost all his son and the daughter in his lifetime. So we as a human being definitely will go through this process, and Dr. Haq will help us how to we face these challenges in our life.
And I think I will keep in pocket. Assalamu alaikum, everybody. Can everybody hear me? Okay. Well, thank you, Sister Dr. Samina. In the group, you have created all the members in that group for this seminar for mental health awareness. And thanks to BIS leadership as well. So before moving to this presentation, I want to give you background. There are almost 20,000 Pakistani physicians in America. In the last 3-4 years, they were going through some kind of a stress which don't want to express anymore. They lost their loved ones. It was their children, they were parents. And I won't go into details that how they died or passed away, because the families did not want to express their grief openly, and they didn't want to talk about it, and they didn't want to talk about the loss of family loved ones, how they died. So that was the background it started, which I presented in UPNA National Conference as well. Now here, we have an audience which includes some physicians, some parents, and few children also. So my goal in next 40 to 45 minutes is to educate, inform all of you that when you leave this masjid tonight, you are able to communicate, you are able to express yourself, and if somebody comes to you for any question, you are able to answer that question. I know this 30 to 45 minute presentation is not a great workshop of 8 hours. I know it will be a brief presentation, then I will leave some time for question answer also. But make sure when I talk about grief, think about any one of you who have gone through any kind of loss in your life. The first and the worst loss is when you lose your loved ones. Loss of a parent is normal. When your parents are 80, 90, 100 years old, but still there are children at that age, they have difficulty dealing with that loss. But think about a person who's 16-year-old or 21-year-old or 32-year-old lost whatever their reason was, their lives. So, is there how to move forward? So, objective is to educate. Objective is to train all of you. If you have a patient coming to your office and they bring up their loss, loss can be loss of a job, loss can be loss of a friendship, loss can be a medical illness which makes you disabled, financial loss, move from any other country to America and losing the values, the cultural values you bring it. So there, if you Google it, it will be over 100 kinds of losses. And if you ask everybody here, one loss is common, that is loss of loved one, but everybody else will give the other details of their kinds of losses they have. So the goal is to educate, train, and talk about these losses. So I won't go into detail because this was a presentation for physicians also. Just focus on only one thing. Grief is the personal response to loss. So how we react to any kind of a loss. When somebody passes away, is there a way moving forward or is there no way to moving forward? How we accept it, how we deal with it, how we can interact with other people. So grief is a deep sorrow, it's a sadness, it's a reaction, it's a normal. But when this reaction is overwhelming, when it complicates life, when you become dysfunctional, that's not normal. So if you see there is something or someone, I put it in red. The loss can be a loss of your friend, loss of your family member, loss of a community member, but it can be a loss of something else. It can be social, economic, financial, psychological, any kind of loss. So if you see, you don't have to read everything, but the reaction to these losses are different. Everybody react differently. So when somebody is unable to deal with it, and when it becomes a stage when they have an inability to accept the loss, if you are unable to accept your 85-year-old father passed away, you believe he should have been living here for 150 or 120 years, that is a loss which you have to deal with it, and it's a sense of disbelief, especially when you lose your child. The worst loss anybody can have it when their grown-up child, which they have spent time day and night, they have lost their loved one, and it is not easy. Just think about a 21-year-old who is in pre-med. That is one of the physicians I went to their home. They died, whatever the reason is, car accident, suicide, whatever the reason is. Once they died, can you imagine that was the only son of the family? And how they will be dealing with it? And 16-year-old, and 32-year-old, and 40-year-old, when they are losing their loved one, regardless whatever the reason is, it can be a car accident, it may be somebody hit them, and somebody murdered them, or there was a medical illness, it's not easy. Just think about if you have a family member who went through some kind of a serious medical illness. As a parent, how you deal with it? It's tough, it's difficult. When you have expectations from your parents, when you have expectations from your children, and if you are not there, or if they are not there to meet your expectations, you feel like you have a loss. That is the issue we have to address, how we will handle that. So among these, if you have seen, the worst part is, among all the 5 complicated grief issues, outcome is bad. Outcome is depression, post-traumatic stress disorder, substance abuse, or some kind of a suicidal behavior. So there was a Swiss American psychiatrist. She said, when you lose something, when you lose a loved one, actually she worked on most of the people. She wrote a book, and the book was Dying People. When she wrote a book, she said how people were reacting, how they were dealing. Most people will go through these 5 stages. The simple is, first you will not accept it as a denial. Second is, you are angry. Third is, you try to negotiate. Okay, it was God-given, it was planned this way, so okay, negotiate it. And the next is, if you are not able to deal with it, depression. When depression becomes a stage, major depressive disorder, and you are dysfunctional, this is a problem you have to treat. But if it's a depression a few days, you're feeling sad and down, and move on to acceptance. Acceptance is, yes, this was written in my destiny and it has to happen, or is God's, Allah's, whatever the decision is, you move on to acceptance. That's the time when you will be feeling better. So the worst part is when someone loses their life. If they lose their life by natural causes, at some stage, I'm sorry if I say 85 or 90-year-old, please don't get offended if anybody is sitting here at 9. If there are natural causes, they die at 95 or 100 years, the grief and loss will be less as compared to if you're losing a child of 18-year-old, 10-year-old, 25-year-old. When you have invested your whole life raising a child, and parents always say to their children, nobody can love you better than me. Both parents says that. And when they lose that person, guess what will happen, the survivor's experience? It is just like a bomb going off. Grenade is going off on a community or a family when you lose someone. You can't deal with it. There is a very difficult situation when you have a debilitating emotions, altered relationship. There are arguing. When the children die, one of the worst things happen in family is the family members fight among themselves, argue themselves. Husband blames wife blames husband for no reason. So that is also a problem. Now, what is the important thing? Time, probably a good deal of grief work. Let me say, if you find anybody in your family, in your friends and community who has lost something, who has done something wrong, even committed a crime, we cannot isolate that person. Your time is tested as a community, as a family, as a friend. When somebody has done something wrong and you go there, in American culture, they take a flower. In our culture, they take a food or whatever. You visit that person. If somebody, by mistake, kills somebody in a car accident, you will not call that person murderer. You go and be a part of grief process. I am not giving all kind of examples what can go. If you have any family member, they are going through some difficult time regardless. It is their mistake or somebody's mistakes. As a family member, as a friend, and as even a community member, you take a step. You walk and drive to that friend and family member and a community member and be a part of in their grief. That is called a community. And we, as a Muslims, we need to nurture this among ourselves. If we lack one thing, I think Dr. Shiri may be here, she mentioned one very important thing in our meeting a couple of days ago, emotional intelligence. I want to say one sentence. We, as a culture, we bring a lot of values with us here. Some people call it baggage. Baggage means negative. Values mean both good and bad values. But in that values, we don't bring one thing, that is emotional intelligence. I don't want to say anything further because I have asked Dr. Shirin to have a presentation. This is the most important topic which almost all of us lack it. The lack of emotional intelligence among our culture is unfortunate. If you want to go home and read about it, that will be very helpful. So this is the part where you will help your patients, where you will help your family, where you will help your friends, where you will help your community. If you're coming to the mosque regularly and you are part of BIS leadership or you are an imam, somebody call you for help, this is what you should do. You will, first of all, acknowledge their pain. And the person who's going through the grief, I will talk about that person first. The person has to acknowledge their pain also. Before they come and talk to somebody, if it is the loss of loved one, probably you are going to their home. But if it is something else, they may be coming and calling you, talking to you. So acknowledge their pain. I'm not talking about physical pain. I'm talking about all kinds of pain. It's an emotional pain also. It's a difficulty in life. The difficulties in life in school-age children is education. In early married life is raising the kids and spending time with the kid is a challenge. Especially if you are working 12 hours or more, it's a challenge. But when you are getting older, turning 50, 60, then medical illnesses come to you. When you start having a grandchildren, you forget your own problem, you think about your own grandkids' problem, then you wait for their get married. If you are older enough, you may have great grandkids. The problems keep on moving. Focus on everything. Accept that grief can trigger any kind of emotion. They can be negative, they can be positive. Understand there is a process you will go through. If you have lost loved one, you will go through that process. If you have lost your job, if you are in a filing bankruptcy, if you have a car wreck, if you have a medical illness, there is a process you will be going through. Now, next number is more important. Seek face-to-face support. There was not technology when this kind of studies were done. So they were always saying, don't call, seek face-to-face. Now, because of telehealth, you can seek telehealth services as well. They are as good as face-to-face, unless you want to just discuss face-to-face in person. Support yourself emotionally and recognize between grief and depression. Grief is normal. Depression is the illness which we need to treat. There are some tips. You walk, you carry objects of the loved one who is lost. You go to prayers. In psychiatry, I want to make sure they used to think that psychiatry is anti-religion. That is not true. One of our part of treatment is referral for spiritual. It can be a Christian, it can be a Muslim, it can be Hindu. You send them to their spiritual places. That is a part of treatment. Ask them to go to the mosque, pray 5 times a day, 2 times a day, or read at home a Quran or a tafsir. It will help you. The grief journey, which I will go. Make sure second crisis, which is the second line. Second crisis is survivors stumble in darkness. When you have big loss, you don't know which direction you need to. You are directionless. You don't know what is right. And sometimes you need to consult and talk to somebody. There is solid ground, a recess, that certain things will work in this grief process, certain things will not work. And your goal is to reduce your pain and reduce your emptiness and move on to next level. The next level is be a part of functional family, be a part of functional society or community. And the last line, which is do what you feel is right, I will come to it again. How to support? Now that was the part, the person who's going through the grief, they have to acknowledge, go through the process. And what you are supposed to do, what you are going to learn today, which you will help your family, your friends, and the community. The first thing is you will listen to the person. You don't go with your own plan and agenda. You have a questions. What happened? Why did you lose your job? Did you do this thing? Did you commit corruption, crime, or something? Don't do that. How did you lose your parents? While they were doing well, I saw them walking, driving a car. Why they died so suddenly? No, that's not your job. Your job is go to the person and listen. Again listen, and give a pause to yourself. Stay quiet. Sometimes they just want to talk about their lost one. Sometimes they want to talk about their loss, any kind of loss. And sometimes they don't want to say anything, they want you to talk. And it is your duty to assess it when somebody is asking you what kind of help you need, assess it. Especially if you have a child, whether in a school or college, they come across challenges. Do not try to find the weaknesses of child. If your child got F grade in elementary, congratulate them. Why? Because nobody gets F grade. Everybody gets A or B. Everybody knows that. In elementary school, everybody is getting. So A and B, those who are elementary, their parents will ignore a lot of stuff. But the child who got F, you have an opportunity. You may not be spending a time with the child. You may not be spending enough time to listen to him. For anybody, any kind of loss, listen and let them express. And they will find coping ways. How? Exercise, go to gym, music, dance, whatever they like. And understand, there are easy and hard days in grief. It's not always difficult. It's not you are always flat faced. There are good days and bad days. And ask for help. And make new memories, find happy moments. If you are going through the process, take care of yourself. That is the number one. And what you can do is breathe, walk, exercise, music, whatever, painting, writing, driving, and be a good friend to yourself. Don't be your enemy. Don't try to underestimate your own abilities and strength. Bring up those strengths and don't underestimate yourself. And if you can't deal with it, ask for help. Where the help start from your family, your close friends, from the community. But if you have a serious illness, go for a professional and ask for help. During grief, conversation is very important. When somebody loses here, one good thing I have seen in the community is you go call them, you take some food and try to stop by them. Sometimes they are willing to talk about it. Sometimes in the early days they may not. But they do let close friends and family members to come and talk. Even their close family members, even your close friend, still have a healing conversation, which is the listening part. Never do one thing, never ask questions. If you see, don't ask questions in an investigative manner. As I said earlier, not to ask him what happened, how it happened, who did it, what's the reason, what did you do? If you have created some stress for a family member, whether it's your parents, whether it's a spouse or child, and there is some bad outcome, it's not time for you to console. It's not time to ridicule and make fun of yourself or your children or parents or anybody. It's a time to heal. Take steps which are positive. Instead of looking for negative things, move towards the positive direction, sit down give an opportunity, whoever is affected. If you are affected, give yourself opportunity. If somebody else is affected, give them an opportunity. And never blame family or friends. If somebody has lost anything, do not blame. For example, somebody is losing a job. You are saying he was always rude, he was always arrogant, he was always unethical, unprofessional. Don't ridicule them, don't blame them. Go and listen to them. They may need your help, and that's the time they test you. Now, there are several kind of techniques which we use, and I don't think I need to go that because that was professional. Now, this is a slide which I created after 24 years of my psychiatry. Now, think about a 100 years old person. They have 4 quarters of life, first, second, third. First 25 years, education. Next 25 years, getting married, having kids. Next 25 years, their kids are married. In last 25 years, getting sick, having great grandchildren, and die. But think about a 20-year-old. 20-year-old who's dying for no reason. They have 4 quarters of 5-year, 10-year, 15-year, or 20 years. Let the parent talk about it. If you have lost somebody who's 100 years old, their children, grandchildren, or spouse will deal much better instead of when you're losing young children. So I wanted to make sure, being a Muslim, we have some connection with the psychiatry. Our religion is more than 1400 years old, but our psychiatry may be 200 years old, maybe 100, but real psychiatry started since Freud, almost 80, 90 years. Look at somebody pass away. Some of you may believe in these things, but I'm talking about those sects of Islam who believe in this. You have a funeral service after the loss of loved one. You pray, you meditate, you come back. There are sects who do kul. Kul is on third day. There are sects who do ninth, the dua, Quran recitation, and they have some whatever tradition 10th. And there is a 40th day, Chaliswa, jisko Urdu mein, Hindi mein कहते. What is the Chaliswa? Actually, it's the time when they say, you have grieved enough. You have grieved enough till 40th day. It's a time for you to rethink and move on to your life. And that is the Chaliswa. And the next one is anniversary. You have memories, you want to give donation, charity, you want to do something on the death anniversary of someone, and this is cultural and spiritual as well. It may not apply to all sects, but those who believe in it may be applicable. Now, how much time? All right, okay. So I think I need to leave some time for question answer, so I will be quick. Now, trauma is any kind of trauma in our life. It can be physical, correct, it can be sexual trauma, it can be any kind of other trauma which can happen to somebody. Unfortunately, this trauma, when it's in a few days and weeks, is acute, then it become chronic and complex. When the trauma is repeatedly the same, chronic, when the trauma is different kind, and it becomes a complex, it turns into acute stress disorder or post-traumatic stress disorder, which is an illness, which we want to make sure when we say mental health awareness seminar, these things, grief can lead to depression, this trauma can lead to acute stress disorder, post-traumatic stress disorder, substance abuse, and many other problems. These are the disorders which problems, psychiatric illness which can happen. So in this situation, if you have a severe illness, seek psychiatric help. Seek some counseling. Now, if you see number 3, I have written religious and spiritual. It's not I have written because I'm a Muslim. It's because this is part of treatment, which we talk to our patient. And when illness becomes serious, you talk to the people who come to you and they have become dysfunctional, or they have severe depression, severe anxiety, severe PTSD, send them for counseling and treatment. So this is the topic we don't want to talk. I want to say one thing. There is study after study. Asking your patients or asking somebody if they have a suicidal behavior, it does not increase the incidence, it does not give the idea to kill themselves. It just helps them to express their feelings, and because of this screening, you can save hundreds and thousands of lives. What we are doing today, what BIS is doing, what WHO is saying, World Health Organization is saying, it's the duty of all of us who are here. It's the duty of the government, state, local community, hospitals, businesses, communities, churches, mosques, temple. It's the duty to conduct this kind of seminars, have an interactive discussion, have some presentation, and talk about it. I will give a credit to NOM a group which you have created. I'm sure it will be helpful for our society. How you can improve your mental health, what you can do, and what you can tell people. Always talk about your positive things. Is it possible? Not at all. 100% all the time, you may not be able to talk about positive things, but always try to do positive things. Be thankful. I think there is a ayat, and Dr. Faisal translated very well when he was asked, "Fabiya la rabbikum atakaziban." What does it mean? Whatever you have, just be thankful, be grateful. I mean, somebody who's working in a McDonald's may be much happier than working as a physician or something else. So it's all how you take these things. Focus on one thing. If you have an issue, address it, work on it, and move on. Move your body. That's very important. There is a difference. In our culture, when we go for a dinner, we just sit and eat. What happens in American culture? They have invited 150 people. There are only 10 chairs for those 10 people who are disabled. Move your body. Eat a good meal. I will not define here good meal because I'm also one of the, right. Open up to someone else. What is that? Can you express to yourself, your spouse, your children, your friends? Have an ability, have somebody you can open up. You get the greatest pleasure when you do something for somebody. Do something for somebody, you will get this pleasure later on. I will not mention one person's name, but I can tell you for last 20, 25 years he's working here. Every year, portion of his income goes to his family or friends in Pakistan every year. He never talked to me by mistake. He told me one time, no, I will not mention his name, but I will tell the whole world that this is a good thing. Do it. If you are from a country where there are challenges and difficulties, you have family members, relatives that need help, help them. All of us should start from, charity begins from home. You start from Birmingham, you help your BIS, then move on to your city, country where you come from. Help them. That's very important. Take breaks, go to bed on time. Anybody who has a fixed time to go to bed, please raise your hand. Very few people. You are very organized and disciplined. If you can keep this pattern, actually those people who sleep well, they will live longer as well. If you want to start all these things, I called it 10 commandments, do it right now. Now this is a one thing. How many of you have Netflix? Netflix. Okay. Half of you don't have access. Okay, if I will recommend you to do one thing, it is very boring. This Kala is a movie, Indian movie. No dance, no, it's not that kind of a movie. So if you spare 2 hours of your life, watch this movie. I have never watched such a boring, but the most useful movie of my life. Is every sentence tells you when you were little, teenager, what did you right, do, and wrong? When you are adult, 20s, what did you do right and wrong? Then you are in 20s, 30s. Different characters in this movie tells everything about psychiatry, which we took 4 years to study. We took 4 years to study. This is a 2-hour movie, boring movie. Sit down and watch. Do not sit with your friends. There is a problem with friends. What's the problem? They talk. And you will miss the most important sentences of this Indian movie. This is actually WHO mental health awareness part, this movie. It talks about all the psychiatric disorders. It talks about how parents have a stigma and they deny. Unfortunately, one of the doctor, when you see it, how he reacted is unfortunate. And in this movie, it's a sad movie at the end, but it gives you a message. If you watch and listen to every sentence slowly, very slowly, every sentence has a meaning. We have like 150 psychiatric disorder. All psychiatric disorder has a one key phrase. This movie have almost all those phrases. I'm not sure how they made it. I don't want to go into details, but one thing is the stigma, especially when parents don't accept the mental illness. How big is the problem? Actually, what I wrote is what I watch. Actually, some people have a better understanding word. You can write much better than that. So just remember, I will ask you one question, what is missing here? You have time-limited life. You have whether 100 years, 50 years, or whatever years. Don't miss few of these things. There is actually a Brownie Ware. She was a nurse, I think she went to medical school or something. She wrote a book about that. Do what you believe is right for you. It's not for the children that you don't want to school, don't want to study. And you are working and you are taking care of your family, you quit your work. No, that's not a mean. So don't please take any isolated sentence. Do what your life is, what is right for you, what you enjoy the most. If you like to come 5 times a day, enjoy it, come here. If you like to help others, do it. If you like other things in your life, travel, just do it. Spend time with your family. The biggest regret, if anybody will have older age, they will say one thing. They will not say how many homes built, how many cars I have, how much money I have, 501, 401, whatever is. They will say I did not spend time with the family. Third is, which is very difficult. Sometimes we stay quiet, we don't express ourselves. Express yourself. If you're angry, upset, say it. But don't be rude or arrogant, just express yourself. Stay in touch in friends and spend time with them. Be happy and you know what makes you happy, just do it. What is missing here? That was not part of the book. That's right, who said it? Yes. Spirituality, religion is very important in a larger portion of the world. 7 billion people, there is a larger portion they believe if they include their spirituality, because the religion shape and form are different for everybody. So if you add that, this is not part of this book, so this is what you can add to it. Thank you very much listening. I saw you guys were very attentive. Generally, it's a boring topic, just like movie color, but you have a few minutes if you want to ask questions. Any questions? All right, thank you. Any questions? Generalized question. If you have specific personal question, ask me separately, call me. And we have a Red Crescent Clinic of Alabama. We have a psychiatrist available also. If you know a friend or family member, they're always welcome. And Dr. Samina has created a group also. In that group, actually, they're trying to address different kind of issues as well. So if you have generalized question which can help the community or society, you're welcome to ask. Sure. I'm a psychiatrist for 24 years. I'm much better, more happier today than I was 24 years. It's not the reason I'm happy with the losses of the other people. It's because you habituate, you develop ability. That's one thing. Second thing is, when somebody talk about their problems, you do not take inside yourself and you become a problem. You listen to other person's problem and try to address it. How to address it? People want to talk about if they have lost their parent and child, they want to talk about the good things that have happened. They may be crying, they may be screaming, they may be yelling. Actually, just being sitting closer to them, be with them, help them. It will not affect you in the long term. It may have an impact at that moment. You become sad because they are sad. If somebody is laughing, you like to laugh with them. Somebody is mourning and crying at the loss of somebody they love. Definitely you will be sad also, and you should be. And it will not affect your life in future. You will think about it. You may have a learning lesson, but it will not affect your life. Very good question. Actually, we have discussed and we want to have a presentation specifically on suicide. Teenagers are in 20s. Now let's go to a little bit older ways, 20, 30 years ago. If anybody was isolating in their room, that was considered a problem and depression. What happens today for teenagers? Everybody has cell phone, everybody has iPad, everybody have access to internet. They want to be alone in their room. They close their door. They don't want their parents to know what they're watching. They may not be depressed, and they don't want to be disturbed. So we have to distinguish between the two. Are they isolating because they are depressed, or they using this social media? Now, social media has positives and negatives, but if they are withdrawn, if they are sad, people will be sad 1 or 2 days. If they got bad grades, they will be sad. If they have a bad day with the friendship, they will be down and sad. But if you observe them constantly sad, they are not eating their food right, they are not sleeping well, their performance is going down, they are not taking shower for 5 days, and they are not doing or meeting with their friends they used to meet, and their energy level has gone down, and they have been gaining weight or losing too much weight. Any of those things are signs of depression, and when somebody is depressed, they think about suicide. Suicide in older age people, and adults unfortunately had increased, but now the middle age people are not exempt. The recent data is totally different, so nobody is exempt now. So watch them, help them. If your child is coming from basement and they are coming and you are always asking, how are you doing? That's the most common question asked. There are days they will say, fine. There are days they don't want to answer it. Let it go. If there are days they want to engage with you, talk to you, sit down, fine. There are days they have their own stresses of life. Education by itself is a lot of stress. They need support. And unfortunately, we, that includes me, we judge our kids with their performance in school, which is the worst thing we immigrants do with our children. Ask your children one question. Who are the best parents on the earth? They will say Indian, Bengali, and Pakistani parents are the best. Why? Because we care and nurture. But when you say, as far as independence, as far as their emotional intelligence, the world's worst parents are Pakistani, Bengali, and Indian. They don't understand their children. They put a pressure. The pressure is always, why did you get 91? Somebody in your class got 99. Your child is not comparable to other person. The people who failed, who got F in elementary, they became president and they became senator. Those who got always A, they may not be the president or senator of the country. So we judge our children's success with the grades, with the GPA, with the ACT, MCAT, SAT scores. And this is the biggest weakness. I can give an example of my child, simple example. My son was in a UAB dorm, and my wife and I decided we want him to be with us. I mean, he should be living with us. We were in the same, I think first year is required, somehow he has to be there. So we negotiated with how he will come back. He said, if I get my independence, what I have in host dorm, I will come back. And I said, you will get 100% independence, except one thing. When you leave home after Maghrib, you will tell us two things, where you are going and what time you are coming. We will not even say, don't go there. We will not ever say that you should be back 2 o'clock in the morning. After 1 year he said, he has zero independence. He was better off in a hostel. At least he does not have to tell anybody that where he's going. So, but he's still with us. Good news is. But the reason I'm saying, is, you listen to your kids. If you put 1 or 2 conditions, they may follow. But if you put conditions, you will eat this, you will not eat this. You will dress like this, you will not dress like this. You have to always pray in the masjid 5 times a day. Even you are in school, you can pray in school, you can pray in a home. Whatever conditions you put on your children, make sure they can do it. The way we see the things, they do not see the things same way. Any question? Well, I want to thank you very much. Sure.
And thank you for really, on behalf of Birmingham Islamic Society, you made a wonderful presentation, I think.
Thank you.
I loved it. I'm sure you look at the faces, they all loved it.
Thank you.
Stunned and listening to you.
I appreciate that.
But from the Birmingham Islamic Society leadership, we like to really do more, because we are very, very sincerely, we are very concerned what's going on in the community. And you know more than us probably what's going on in our community, like how the teenagers suffering, all kind of things happening, right? We have the issue drugs, we have the issue, all those things, right? So what is that we can do as a community from the BIS leadership to really bring more awareness, to do more about them and help?
So one thing which I want to appreciate, today 50 kids BIS sent for a ski trip today. Is that correct?
Yes.
So if you involve, the reason we don't see those kids today is the reason which I was not aware. I just was told today that the young people are in a ski trip. So if you engage your young generation in healthy activities, this is a one good thing. Now, having a seminar, generally in most seminars are like this size. You get people somewhere 20 to 50 people. So if you make them ambassador, the people who show up regularly, they are your ambassador to go to the community wherever they live. Anybody asks them help, train them. This is the group of 50 people which you can actually train. Most of them will come regularly. Train them, educate them, and the topic of mental health awareness, and this will help. Now, I have worked in Bradford Health Services. So this is unfortunate to say. Unfortunately, from our community, I saw several young kids in that facility. Anybody knows what Bradford Health Services? A drug addiction, yeah. So in our community, I've seen people there. But you know, it's a confidentiality, you can never talk about it. So what you can do, it's not 1, 2, or 3, or 4. It's not from one country. So all of the countries you are sitting here, I'm talking about. So addiction is a problem. The next thing is, if you create a culture in our homes, which is strict to an extent, we drive them crazy, then you need to work with the parents also. There are things which you will work with the children, and there are things which you will work with the parents. We as parents are not as good as other parents are. We are good in supporting them, giving them money, giving them a car, giving them good food, but we may not be good understanding them.
So you said it so right, actually. It just reminds me one of the quote of Hazrat Ali ibn Talib. You know what he says? He says, raise your children not based on how you grow up with. Raise your children as the future generation going to grow up with. So he advised the parents to be a generation ahead of them to raise the kids. Because it will be a failure if you raise the kids the way you are grown up. Because life moved on one generation. Subhanallah, that's the point.
Very good. You gave an example of 1400. I give you example today. The way my wife and I raised kids were, because I was working, she was at home, she wanted to take care of the things. She will turn on the TV, cartoons. They will sit them watch hours and hours, 3, 4 hours, 6 hours, and feed them. Now my daughter has 2 kids. They can't watch TV Monday to Friday. Friday night, they have a movie night and watch TV. They have to go to bed every night, which is crazy, 7 or sometimes 8. When we were raising our kids, many of you know, our kids were young, we were taking them into the party till midnight, they were awake. So what's the difference? As you gave an example, 1400, today, the way we raise our kids don't like the way we raise them. They said we were not disciplined, we spoiled them, we did this wrong, this wrong. Kids say that. You will see their kids will tell them that the way they raise them is not right. So we tell our kids also that if you are telling us we didn't raise the right way, your kids are going to tell you in next 20 years you are not. So what is the message is, we change as much as we can. We start with the parents, adults, especially those who are raising little kids, have a meeting. It's not for one person, it's for the society. If you train these 50 people and they educate everybody in the society, you got your results. Any other brother question?
Any other question? Yes, brother.
Since you were talking about that trauma and immediate trauma, post-abstinence, some people are involved at the old age in their past one, what they did in the past. Repent them.
You have asked a very good question. I will show you what the question is. Actually, this book talks about something different. This book talks about regrets in life. But I didn't want to talk about regrets in life. When people get older, they have a different kind of trauma. They have a family trauma, friends trauma, business trauma, medical trauma, accident or whatever. But what is the biggest regret in the older age? They did not spend enough time with their children. 1 second. If they want anything from their children on their birthday, what's that? They don't want a gift. If you are trying to buy a gift, a phone, iPad, watch, or something, no, they don't want any of those things. They want you to come over to their home, wherever they are living, big or small, spend time with them, or take them for vacation somewhere. One biggest regret is they did not spend time. The second is they think about what has happened in the past. They have nightmares, flashback, they wake up. If they have a severe illness, they get to treatment. But they didn't do the things they wanted to do. They should have done it. Some of things I won't mention here, but you should have done it. Express your feelings. They were not very expressive. But if the trauma they have got, regardless what kind of trauma, if it's severe enough, get treatment. Yes, brother. Brother has pointed out, you remember there was a slide at the bottom. What is missing here? Islamic Code of Life. Quran is a symbolic book. I'm not a religious scholar, so I don't want to say anything more. It's a symbolic book which gives us direction to every part of our life. But you are right, we read in Arabic, and Arabic is not my language. If I read a translation, I don't read a right translation. I need to read a tafsir, explanation, and details. Now, brother, what you said, if all of us do it, we don't need a psychiatry. Then we will be out of business. that will happen. Anybody else has a question or comment? Yeah, Assalamu alaikum. I will give you first example of a neurologist, what they say, then probably most people will listen. We have two neurologists. If you talk to a neurologist and ask them one question, since I moved to Alabama, what is my risk of stroke? Guess what will be their answer? They will say, regardless wherever you come from, Midwest, New York, Delhi, Bombay, Karachi, Dhaka, after 10 years, your risk of stroke is same what Alabamians have. Whether it's true or false, that's one thing. Now I will come to your question. Your question has actually 3 or 4 parts. One is cultural, second is spiritual or religious, third is social, economic, or psychological. I will say one sentence for each. Religious, I came from Pakistan. The best form of Islam I have ever seen in my life is Birmingham. I have never seen better Muslims in my whole life. Actually, I saw Islam here. That's one thing. That's religion or spiritual. The second is cultural. So cultural, whenever you come from a culture, you bring your values. What you see people here, generally all of us have same cultural values. People call it baggage, the bad values, bad stuff we are bringing, but we do bring our good values, and you can ask your children and they will say you care for them. Those values identify us. So there is a research in behavioral science. If you stick to your own group, this is your group, whether you make a group between Muslims, whether you make a group of your professionals, whether you make a group of your country or region, you become more happy. Being around the people of your own culture, even though people say you should assimilate, but when you bring the values of your own culture, as far as economical, two things I have observed. In our community here, I know people who belong to a very, very rich families back home. And they are doing here jobs which their parents will never allow them to do that. But in my opinion, this is a good thing. If they were back home, they will be doing nothing and they will have everything of a life. I think working, struggling, enjoying the life. Second is, some people have opportunities, they have excelled really well, and they are enjoying all the things which I was mentioning, Fabiya, Light, Bikumat, you got everything here. So these are the three aspects, but there is a very detailed discussion about that. I think whenever we have a plan for workshop, Dr. Smina has a plan, so we can have a different sections where people can talk about their own experiences and discuss it. Did I answer your question? All right, thank you. That's true. All right.
Okay, brother. Thank you again. And clap for the brother. It was a wonderful job, inshallah. Thank you so much. So we're going to, inshallah, close by just saying a few dua, inshallah.
Sure.
Alhamdulillah, Rabbil Alameen. As-salatu was-salamu ala Rasulil Kareem. Amma ba'd. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار وصلى الله على خير خلق نور عرشه سيدنا محمد وعلى آله وصحبه أجمعين برحمتك يا أرحم الراحمين والعرش إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار آمين الحمد لله رب العالمين.